Hello and welcome to Exercise for Special Populations. This is for injuries, Hello and welcome to Exercise for Special Populations. Tonight we're going to be going over orthopedic injuries, looking at lower body, low back, and upper body, looking at common injuries. This is for exercise science class for Mesa College, spring of 2017. I am your host, Pete McCall. I'm putting this up on YouTube to access for my class, but I'm also putting it up just for general information. So whether or not you're studying anatomy, physiology, or whether or not you're studying exercise science, this might be good information to help you remain injury-free in your favorite exercise or physical activity program. So main thing that we want to pay attention to is that if a client has pain, that they see a medical professional. So if you're a personal trainer or group fitness instructor, if somebody comes in and they're in pain or they experience pain during a class, you really need to recommend seeing a medical professional, especially if it's extremely acute. So what we can do is design exercise programs to help reduce pain, or design exercise programs to improve stability, mobility, and strength. But we're not physical therapists, so we can't fix pain. We can only help people move where they have a comfortable, pain-free range of motion. So if a client's really sore, the most important thing is the client should be resting. Let the injured spot heal. So with that said, what we're going to go through tonight are some common injuries that clients may experience and how you should deal with them as a personal trainer or group fitness instructor. So common injuries include low back pain, knee pain, sprains in the ankle, and shoulder injuries. If you think about, these are some of the most mobile parts of our body, and if we lose tissue extensibility is the ability of the tissue of the muscle to lengthen and shorten. That controls joint mobility. So if your muscle loses the ability to lengthen and shorten, which can happen if it's held in the same static position all day long, that it can affect long term how your joints move and how your body does a variety of different movements. So that's where we really want to pay attention to. If you're starting to feel pain in what you do, you need to look at your movement and look at your client's movement patterns and ask, are they moving in all directions? Are they taking their tissue through full and complete range of motion in all three planes of motion? So that's where we're going tonight. I mean, that's ultimately where we're getting to with this lecture. So screening the client, we want to make sure the client is active, make sure the client, if the client has a history of pain, the client's being seen or treated by a physician. When screening and going through the medical background of a client, you want to know if there's any reason at all why the client should get a medical waiver or get a doctor's note prior to exercise. What we're trying to do is screen out pre-existing conditions or anything that can influence the individual's adaptation or individual's response to exercise. So we need to identify pre-existing conditions. Do those pre-existing conditions influence the body's response to exercise, and be able to program around that? Principles of restorative exercise. We're trying to help promote the body's just natural movement. We're trying to progress people through the 4 phases of the ACE, American Council on Exercise, Integrated Fitness Training Model. What you're trying to do is enhance stability of the stable joints. The lumbar spine is designed to be stable. Your scapula, the scapulothoracic joints, are designed to be relatively stable. If those joints lose the ability to maintain stability, it could create pain in the system. Likewise, your foot and ankle complex, your thoracic spine, and your hip. The hip isn't written in here, sorry, I overlooked that. But your foot, ankle, your hip, and your thoracic spine are your most mobile areas. But those are the areas that are at the highest risk of losing mobility. So if you lose mobility in your foot, it could mean you lose mobility in your hip. If you lose mobility in your hip, you lose mobility in your thoracic spine. That's why the ACE AFT model goes through these 4 phases, because we have to restore stability to the stable joints and enhance mobility of the mobile joints. Then we have to integrate stability and mobility. So we have to combine kind of mobile stability or stable mobility. Then we have to do load training. Load is just applying an external resistance. Load is now we're picking up an object and we're moving through a range of motion, but with a load to improve force production. And then finally in phase 4, we're going to increase the speed of force production. Now the interesting thing is, I was on the design team when we created this at the American Council on Exercise, and we did this back in 2008, 2009, and about the same time, Stuart McGill, who I'll reference a little bit later in this talk, Stuart McGill, actually, I think he'll be in part 2. Stuart McGill, a researcher out of Canada, came up with a model of exercise program design that is extremely similar to this, a little more segmented in the earlier phases and a little more structured, I guess would be a better word, a little more structured, especially in the earlier phases, but that's with an eye towards complete rehabilitation from pain. So as personal trainers, we don't pull people out of pain, but we work with people who are asymptomatic. McGill's model is a little more in depth to deal with people who are in pain, but otherwise, if you look at 2 models, they're extremely similar for how to progress. So concept of healing is evolving. You know, we know that when we have an injury spot, we get inflammation. Inflammation is a sign that your body is trying to heal a specific portion. It's bringing extra fluid, extra oxygen, extra nutrients to the area. That can also impede, what that can do is impede joint range of motion. But part of the healing process is you're going to layer down new fibers along the injured fiber. So if there's a muscle or tendon that experienced an injury, part of the healing process is to lay down new fibers to help repair that tissue. That's why what they're starting to do in physical therapy and in the medical community is get patients moving as soon as possible after having a surgery, because they don't want the scar tissue to develop. So that's why when I said things are evolving. So if you have somebody who's coming to you after being released from physical therapy, or if you have somebody who's coming to you with an acute, meaning recent injury, you need to make sure they've been cleared for activity, or if they're under physical therapy's treatment, what they can do for exercise. You want to have a clear communication between the medical provider, if it's a physical therapist or a doctor, and understand what can this client do and what should the client avoid, because you want to be able to use exercise to promote the healing process, not increase the rate of injury. So who are we serving? We're serving a variety of different people, but when we look at a lot of clients coming in to see us, they're probably a little bit overweight, and a component of that is you're going to have a higher risk of orthopedic injuries like low back, like knee, and like shoulder pain, because if your body is carrying additional weight, it's going to change the structure and the function of the joints. It just is. I mean, if you look at the additional girth that the man on the left is carrying, it's going to change the way his hips move. It's going to change the way his back moves. Same with the woman on the right. It's not. It's just understand that we can't. There's kind of a 20. Catch 22 is we need to get these people exercising to help them lose weight. But if we try to progress their exercise intensity too quickly, and they haven't learned how to move and control their mobility yet, we increase the risk of injury. So we need to make sure that at the same time we're trying to increase the intensity of exercise, that we're increasing stability and mobility. That's why we create that 4-stage process, because as they're improving their body control, they can improve the intensity of exercise. We want to start with lower intensity exercise specifically to allow people who are overweight and sedentary to allow their bodies to slowly adapt to the stress of exercise. So in the early phases AFT model, there's a lot more emphasis on body weight training, stability, mobility exercises, and body weight training with full body movement exercises. This is a low stress introduction to exercise. So using the core, what we want to be able to train the clients how to do is use their core effectively. And we'll talk about this a little bit more in McGill's model. But when you look at your clients, you understand that gravity impacts them. Gravity pushes down on the body. Ground reaction force pushes up on the body. So what we need to do is be able to stabilize the body against those forces. If you look at the 2 pictures on the left, that's how a lot of our clients like to use their bodies. They like to be up on their feet. They like to be doing things. But if you look at how many people commonly train the core, the picture on the right, lying down, that's just completely incorrect. Because when you lie down on your back, you're changing gravity's position on the body, and you're using the muscles in a way they're not designed to be used. All the muscles in our body are designed to be most effective when our feet are on the ground. So if we want to help people, if we want to help our clients to have a stronger core, to reduce low back pain, and to be honest, improving core strength can reduce the risk of a lot of other orthopedic injuries as well. Core strength can reduce the risk of knee, ankle injuries. It can help improve shoulder strength, so reduce the risk of shoulder injuries. So, we kind of think of our training starting from the foundation out and working from there. And we need to understand that we need to train with gravity on like the photos on the left, because to be honest, when you lie down, that's like a sedative, and that starts setting up your parasympathetic nervous system which is your rest and relax nerve, kind of side of things. So it's going to desensitize and reduce muscle activation, whereas standing on your feet actually increases muscle activation and actually excites the nervous system instead of shutting it down. So again, this is how people want to use our bodies. That's why we want to train our core on our feet, because when we look at how clients use their bodies, we use our body, why are we training laying down? We can't strengthen our core when we're laying down. That just, it's not happening. And that could lead to, actually lying on the ground could lead to increased risk of orthopedic injuries, because you're not training your body how to deal with the forces created by gravity and ground reaction. So we need to keep that in mind and tell our clients that when they ask why they're doing a number of these exercises. So isolation training could increase low back pain, because if somebody has low back pain, they're trying to strengthen their core by doing crunches, all those flexion cycles in the spine are going to cause irritation and make it worse. So we need to respect the movement efficiency model. This is from Shirley Sarman, and the body adapts in response to stresses placed upon it. That's Wolff's law in relation to osseous structures. So osseous or bony structures will kind of remodel or rebuild or reshape themselves in response to mechanical forces. We also have Davis's law, which Davis's law is soft tissue models along lines of stress. So you see our different systems. Our active systems are the muscles. Our passive systems are your joint capsules and ligaments. You also have your skeletal structures, because the passive systems are the joints, the ligaments, the bones. They react to the movement of the muscles. The muscles stimulate movement through contractions. The muscles receive neural input from the nervous system through proprioceptors and specifically motor units. So we get the nervous system activation of the muscles. The muscles drive activation of the joints and of the connective tissue. That's what we know as biomechanics. So if there's a faulty system somewhere, if the muscle length tension relationship is out of balance, our our joint position is out of balance, if joint position is out of alignment, then the ligaments will not be able to lengthen and shorten properly, or the ligaments will have an experience in length change. The Davis's law, in response to Davis's law, they'll have modeled along the line of stress and become shorter. They'll change the range of motion of the joint. If people remain sedentary, the nervous system, the proprioceptors, especially in the joint capsule and especially in the ligament endings, the proprioceptors aren't getting any stimulation, so the nervous system function at that joint is going to be inhibited. So all those go in together. Those increase the risk of injury. So what we want to do with exercise is restore the proper length tension relationship of the muscles, restore the proper range of motion in the joint structures, and improve the ability of the neuromuscular system to activate the right muscle to generate the right force at the right time. So that's what we're trying to get to. Sensory motor input, meaning proprioception, to improve motor output, meaning muscle contraction. We improve joint mobility and stability, and we can improve movement through the basic foundational patterns of movement. That's what we're trying to do with training, and that's how we reduce the risk of injury. We have to understand that everything in our body is connected. You see all the tissues. When one muscle moves, it influences motion, all the other joints and tissues around it. The only time a muscle works in isolation is in a machine designed for joint isolation. Otherwise, when we're moving on our feet, we're using all the muscles and joints together. So that's how we can improve. That's how we can improve our client's strength, and that's how we can reduce the effect of orthopedic injuries. Is restore balance to the body, teach the movement patterns, teach squat and hinge patterns, teach single leg patterns, teach push, teach pull, teach rotation. Because when you teach the body how to move, you're teaching all the systems to work together, and I guarantee you'll address most of the musculoskeletal injuries that clients will face. We're not working with people who are in pain, but we're working with people who are experiencing discomfort and are able to exercise and want to exercise away from pain. So that's where total body training comes into play. You see all these movements use all of our muscles together. That's what we want to challenge our clients to do. Some will be better than others, and that's why we have those stages of progression. Stability, mobility exercises first, movement exercises second. Integrate stability and mobility. And that's what we're trying to do. We're trying to restore proprioception. We're trying to restore balance. We're trying to restore length tension relationships. Flexibility is often a misconstrued concept. Flexibility is a combination of two things. Flexibility is the ability of the muscle or of the tissue, the muscle and the connective tissue, to lengthen and shorten. That's called extensibility. The ability of the tissue to lengthen and shorten is extensibility. The ability of a joint to move through a range of motion is mobility. So the extensibility of the tissue enhances mobility of the joint, and that's where a combination of it is flexibility. So when we do flexibility training, we're trying to control joint motion with muscle activation, basically body weight exercises. Static stretching can restore length to a tight muscle, but it desensitizes the muscle as well, because when you restore length, you're basically shutting the muscle down. In essence, so we want to try to minimize static stretching before activity. You can do static stretching as a component of a warm-up, but it shouldn't be the only warm-up. If you want to really improve mobility, body weight exercises are the best. Squatting, lunging, push-ups, body weight pulls, that will restore flexibility and mobility to all the involved joints that we use on a regular basis. If we want to reduce muscle tension, focusing on a specific area, we can use a foam roller or myofascial release. If you do a search for myofascial release, foam roller, and my last name, McCall, along with Ace Fitness, you'll get an article I wrote on foam rollers, going through the science of how to use a foam roller and why that works to improve flexibility. So McCall, Ace Fitness, myofascial release foam rollers, and that'll take you to an article explaining the science of that. So low back pain, we're going to take a quick look at low back pain. Then in part 2, we'll go through the phases of how to address pain, whether it's low back or any other musculoskeletal injury. So low back pain is a big issue because a number of Americans have it, or a number of Americans experience it at some point. Honestly, low back pain, it happens with people who don't move much. Your body's designed to move. If you just stay sedentary, the joints don't go through the range of motion. When the joints go through the range of motion, they don't learn how to do that, and the tissue tightens and restricts joint range of motion. When that happens, your body loses the ability to feel what's happening in the environment. You lose proprioception. So everything kind of ties in together. So what we want to do is we want to restore mobility first, and we want to restore stability in order to help people move better. And then we want to keep people away from doctors' offices. We want to keep people out of pain, and we can do that. Generally, people, approaching, I hate to say it, middle age, but between 30 and 55 are probably at the greatest risk of experiencing low back pain. There is no strong association with body weight, but generally more heavy-set people will probably experience a higher risk of injury of low back pain. That's not going to be chronic, meaning ongoing, but they'll probably have more frequent bouts of experiencing low back pain that limits activity. So that's one of the reasons with overweight individuals, we just want to try to help them move very slow at first, because we want to increase range of motion and strength, because they're at the greatest risk of pain from exercise. So activity-related factors, look at occupation. People who sit a lot for work are at a much higher risk of low back pain. Driving, people who drive, or people who have shifts, prolonged work standing, could experience low back pain. So there is no one category. It's just understanding from this, you want to take away, you want to understand how your client uses their body on a day-to-day basis. What's your client do for work? Do they sit all day? Are they standing all day? Is there a combination? How long does your client commute? Because the length of your client's commute will determine additional time seated. Anytime sedentary is going to influence the motion of the back. The more activity somebody can do throughout the day, the more mobility they'll have in their hips and in their thoracic spine. But if they limit their activity throughout the day, it's going to restrict motion in the mobile parts of their body. So what we want to do is follow a systematic progression of programming, and I'll go through that in part 2. So we'll increase range of motion and flexibility first. That's kind of what we're doing, stability and mobility exercises, and then we go into movement exercises. We're increasing stability of the stable joints, increasing mobility of mobile joints. When you increase mobility, you increase tissue extensibility, so you improve flexibility. Flexibility and mobility are somewhat synonymous. However, mobility refers primarily to joint motion. Flexibility refers primarily to the ability of muscle tissue to go through a range of motion. So they're very similar, and sometimes I use them interchangeably. One thing we have to understand, though, is with any individuals dealing with any type of pain, low back pain, foot pain, knee pain, if they experience pain, it may reduce their ability to participate in their favorite activities. So you want to make sure you pay attention to these people kind of state of mind. We are not, personal trainers are not psychologists, but we want to be able to identify that if somebody's at risk of slipping into depression because pain is affecting their life. And that's where we can recommend, hey, you may want to, next time you see your doctor, you may want to run this by them and ask if there's anything you should be concerned about. That's what we can do. We're an outside observer, and if we notice that our clients' lives are being affected by anything they're dealing with on a day-to-day basis, we can't tell them to correct it, but we can ask them questions about it that suggests maybe they go in that direction. So anyway, enough about that. So role of exercise in managing pain is that the right exercise, the right movement program can be the cornerstone of getting people out of pain. And again, there's another catch-22, because if a client's in pain, it may not be comfortable to move. It's like, oh, my back hurts, or but we have to find ways they can move that's not going to aggravate that part of the body. That's why looking at the stability mobility phase of exercise training, the ACE model, is a smart way to do it, because a lot of those exercises, the client is laying on his or her back. We can improve range of motion of the hips from a very stable position on the back. We can improve core stability from a very stable position on the back. So that's where we want to be able to start in a very, very foundational component of exercise. When someone's laying on the back, we take gravity away. So in later phases, we want to use gravity as much as possible, but the initial phase of exercise in stability mobility, we want to take gravity away so we can strengthen the muscles, control joint position first, and then we can overall increase the body's ability to be strong and the body's ability to perform a client's favorite functions. So this is part 1 of this lecture. Part 2 will be up as well, and if you're in the class, you have to take it. If you're not in the class and you're just looking for good information about exercise, you can come back and do that at a later date. So we'll start it from here.